Basically, in today's presentation, you're going to learn about what the scientists are concluding about risks to individuals and public health from fracking. Now, you might be familiar with some of the science around fracking already, so this might give you some basic information as well as just something really conclusive after having some time to really make these assessments. There's a very specific assessment that's been done by Delaware Riverkeeper Network, and Mark and Erica, who are presenting today, are going to talk about their findings, the results of an economic, health, and social impact assessment. And then also what people in Pennsylvania can do, both short-term and long-term, to transition away from fracking and this idea, the fracking boom. And so I think the Q&A is also going to be rich with some of this as well. So the question is, where are you joining the webinar from? And some of you have already jumped in the chat to share that. So thank you so much. And I love seeing all the different voices here, who's paying attention. We've got a good turnout so far, over 30 people on live right now. And just before I get Tracy from Delaware Riverkeeper on, my name's Ryan. I'm with Halt the Harm Network. I'll tell you a little bit more about Halt the Harm after the webinar for those of you that are new. We're basically an organization that provides services to support the movement, to support people like you that are dealing with oil and gas issues that are wanting to confront the movement. And so one of the ways that we support the movement is by providing and hosting these webinars. So awesome. And also, so quick hellos to David from Billings, Montana, Adam, who's DC based, but Pennsylvania, who says Pennsylvania is the canary in the coal mine. And Dallas is in southwestern Pennsylvania. And Robin from Southwest PA, team at Food and Water Watch. Awesome. Cool. Glad to have everybody here. Tracy, can you hear me?
Yes.
Oh, fantastic. So we've got Tracy on the phone right now. Tracy's calling in from Delaware Riverkeeper Network. How's it going, Tracy?
Good. Everything's good. We're over here in Bristol, Pennsylvania, just a little bit north of Philadelphia.
Awesome. So can you tell us a little bit about the report and how Delaware Riverkeeper Network put together the report that we're going to be talking about today?
Sure. So Delaware Riverkeeper Network commissioned 2 reports. We have been addressing and trying to deal with the negative fallout that has occurred as a result of fracking in Pennsylvania, and we felt that there needed to be an update on the universe of health studies that have been done on fracking throughout the United States, but focusing as much as we could on Pennsylvania. And then also we felt that there was a real need for looking at economic impacts of fracking and looking at the full picture, the externalities, particularly, and those things which are perhaps not as easily monetized or are avoided by the industry and sometimes decision makers and politicians because of their long-term and heavy impact on our economy. So since 2008, you may know that fracking has increased tremendously in Pennsylvania, and in many ways it really defines the areas where the shale gas extraction is happening, also the processing, the delivery, and the end use as well. We hear a lot about the benefits of natural gas from the industry, and from government entities as well, and ads on TV and radio claiming that natural gas is a boon for Pennsylvania. And many public officials support that fracking continues, particularly in the legislature and the governor's mansion here in Pennsylvania. And some are even attempting to relax current regulations to aid and support increased growth. Amazing that they would think that they could actually use more growth. But communities that are in the midst of fracking and its activities related to it really live, as those of you who live in that world live live in a different world than these TV ads. And that's in terms of health impacts and also the effects of locally and statewide in terms of economics has certainly not been examined in any comprehensive way or any disinterested way, and is affecting our world in hugely, particularly when you consider the long reach of climate. So these reports take a look at the health and the economic impacts of fracking in two different reports, focusing mainly on Pennsylvania. Experts from Frack Tracker Alliance analyzed the scientific and the academic papers and various studies that have been published in the past 3 years, from 2016 January to December 31st, 2018, in order to update an earlier analysis that had been done by PSE. And that looks at the health effects of fracking. And then experts from Eco Northwest evaluated the health, community, and environmental cost of fracking in Pennsylvania. And representatives of each of Frack Tracker Alliance and Eco Northwest are going to be on the webinar, as Ryan said, after the videos. And at that time, I'll introduce both Erica and also Mark, who are going to be who are authors of these two reports and who are going to be answering questions.
Fantastic. Thank you, Tracy, for giving some context to the report. We're going to move on to playing the first section. This is like a 15-minute presentation by Mark Buckley, PhD, partner and senior economist with Eco Northwest. He designs and manages economic analyses, typically involving water resources and land management. The majority of his work focuses on improving efficiency of investments in watersheds and water resources, including integrated planning, restoration, conservation, and damage recovery. Mark serves as an expert witness on natural resource issues and has published research in peer-reviewed journals and other publications, and is the lead author of The Economic Costs of Fracking in Pennsylvania by Eco Northwest, commissioned by Delaware Riverkeeper Network. The next piece we're going to play right after that, without a break, so we just have a continuous presentation that's about to start, is with Erica Jackson, the Community Outreach and Communications Specialist at Frack Tracker Alliance. Erica has researched emissions and health impacts from unconventional oil and gas development and environmental justice concerns regarding Pittsburgh's air quality. She received her bachelor's degree in environmental studies at the University of Pittsburgh and co-authored Categorical Review of Health Reports on Unconventional Oil and Gas Development Impacts in Pennsylvania, Frack Tracker Alliance, commissioned by Delaware Riverkeeper Network. So getting ready to start the first presentation. And since we started, a whole bunch more people have joined in, so looking good, and enjoy this, this first part of the presentation on the economic impacts. Switching my screen, and we are good to go. Just need to also share the audio here. Awesome. And if you can't hear the audio for any reason at all, please just let me know and I'll be able to jump in and fix that.
The key factors, the takeaways that we had were that these costs, the subset of costs that we're actually able to identify and quantify attributable to fracking activities does get us up into the millions of dollars a year, easily tens of millions, and talking about billions of dollars when we're looking at the cumulative effects over time. So we're talking about costs on society that are on the order of magnitude of the amount of employment associated with fracking. So as much as we hear about the benefits of fracking activity in terms of job creation in places like Pennsylvania, the subset of costs that we can identify and the subset of costs that we can actually put a dollar value on is up to that scale and probably quite a bit higher. I think as we walk through the consequences, the health effects, which have a lot of pathways to people in terms of groundwater, surface water, air quality, it's a little bit hard to tease out the specific chemicals and the specific pathways, but there is a preponderance of evidence that the actual statistical changes in health outcomes for communities that are close to high concentrations of wells are quite strong. We're looking at, in this report, where there are specific financial health expenses associated. But we all know that that's only a small piece of the puzzle. So, for example, if we're looking at the costs of hospital treatments for low birth weight children, that's one factor, but that's really minuscule in the scheme of what parents consider the overall consequences of having to worry about the health of their children. So I think I would also emphasize when we're walking through the cost that we're able to quantify here, this fact that we are trying to focus on where there's information available and dollar values available that we can associate with them, that we're probably missing some of the big consequences. Again, thinking about some of the specifics, sleep disruption, depression, we can quantify some of the effects of those adverse consequences via expenditures, lost workforce productivity. One of the situations that we're dealing with here is trying to trace these effects through to what people would really care about and how they can think about these consequences. So I think it's important, if you're looking at this report, this kind of information, is not to focus on the dollar values as much as to try to understand what the effects are and then recognize how the dollar values give us a sense of their magnitude, but recognize where the dollars don't tell us the whole story. So migraines are an example of an effect that we're seeing a pretty strong increase in the rate of migraine occurrence for people who live close to these wells. There's a whole range of potential disruptions in a community when you have this sort of temporary, very boom and bust kind of economic activity that comes in. So it's often very specialized. It's often difficult to fully incorporate or build in the local labor force, and when they do, it can have secondary consequences for other industries. If you're trying to achieve some level of economic development, you want some sustainability, and this is sort of the opposite of a sustainable industry when we're thinking about the actual drilling activity, the fracking activity itself. So it's often that there's a fair amount of crowding out in terms of housing, in terms of labor force, congestion in terms of infrastructure, roads, wear and tear. And if you're bringing in people from outside the area, they're often disconnected. They don't have a local connection to the community. They don't have friends and family. There has been plenty of information around increases in crime rates, drug use associated with areas with this kind of temporary and non-local labor force that can come in. Big picture question about this sort of focus on a resource extraction industry and the kinds of jobs that it can encourage and the kinds of businesses that are affected by it in the positive ways in comparison to other economic development strategies for these areas. So if you've got non-local oil and gas businesses coming in, bringing in labor from outside the area, it's a short-term burst. They don't have any real commitment to the community, to the region, to the resources of the area, and there might be this short-term burst in spending that can have some temporary benefits. But if you're thinking about the long-term consequences in the area, we're seeing that property value goes down. People don't want to live near these wells. Other jobs are negatively affected. Tourism and just sort of general attraction in many of the region can go down. So you see these long-term negative effects on other industries and just the overall appeal of the region. That increasingly in the U.S., what communities are trying to do is compete for businesses that pay good jobs, that employ highly skilled workers, and those highly skilled workers want to live places where they can raise their family, where they feel like it's a healthy place, a safe place, a strong community. And so you've got problems whereby both existing businesses are going to be harmed through this activity, existing labor forces, but you're going to have a hard time attracting some of those more resilient long-term industry and skilled workforce that areas really want. I think there's also the long-term effects of this sort of boom and bust cycle for an economy in a region. There's something that we often see, especially in the Midwest, where I grew up in Ohio, where you've got areas that had boomed and the infrastructure, the downtown areas, the businesses all expanded dramatically around some single industry, and then when that industry goes away, there's a lost sense of community and a lost sense of economic vitality that can be very difficult to overcome. You see this in extreme cases like Detroit, where trying to step back from a build-out from a larger level of population and economic activity, and that can be very expensive and difficult to achieve, and people tend to leave in that situation. So there's a potential that fracking activity, especially in these counties that have had very concentrated well development, are going to have a long-term challenge to maintaining their community, their infrastructure, their baseline industries, their households, their housing supply. It can be very disruptive to housing prices when you've got big swings in overall population. In terms of the environmental consequences of this fracking activity in Pennsylvania, first of all, you have to understand what the pathways are that fracking can affect the environment and habitat in Pennsylvania. That the well pads where the drilling actually occurs, from a surface area perspective, is a potentially large total area of landmass, particularly given that it's often in agricultural or even forested areas. So we're talking about probably around 100,000 acres or so that's affected directly. So there's direct disturbance there, not to mention all the traffic and the activity, the light, the noise, the sound, and its effect on wildlife populations in the vicinity. But then in terms of direct functions of natural capital, natural ecological systems in Pennsylvania, we'll see disruption from the surface activity as well as subsurface activity, and that's where things get complicated. So first of all, there's sort of some direct disturbance that can occur, and contamination from chemicals and disruption to the natural systems. But then we have a whole range of potential long-term bioaccumulative effects and contaminations of surface water, aquatic habitat, and then via some of the air pathways, we've got other contaminations of ecosystems in Pennsylvania, which can again have disruptive effects for birds, wildlife, fish populations, and there are recreational benefits associated with those. People in Pennsylvania care about having native wildlife that's healthy and active. Hunting and fishing is affected by those kinds of consequences. And ultimately, I think there's a potential loss of faith in the reliability of the resources that Pennsylvanians depend upon, their drinking water supply, their groundwater. We're already seeing that in terms of avoidance or averting behavior, where people are using more bottled water in Pennsylvania. People don't trust their groundwater wells. People are selling their homes. The effect on property value of being close to a fracking well, particularly if you rely on groundwater, is substantial, and we're talking about over $1 billion in property value that's been lost that way already, and probably more, because it's often hard to isolate those the whole set of consequences for willingness to pay for homes when you're in an area with all sorts of disruptions and potential unsafe environment for your family. Same effects of fracking that can translate through to negative consequences for public health can also affect the attractiveness of recreation opportunities and really demand both from residents and potential tourists. Recreational fishing in Pennsylvania is a multi-billion-dollar industry, and plenty of surveys have shown that people are not willing to go to parks, to go fish, to hunt in areas that are close to wells. They don't trust the effects, and it's generally a lot less attractive in terms of the environment. So recreation is an important industry as a whole. Outdoor recreation in Pennsylvania is an important industry as a whole, not just for the overall magnitude and the expenditures and the overall economic impact in the state, but it's also important to residents directly and some of the intangible benefits they have, from access to a clean, attractive environment, trails, streams, mountains, forests near where they live. And if they don't feel like those are safe places to go, or if they're just noisy and loud and being disrupted by drilling activity, that makes the place just less attractive as a place to live, to work. And so it also can translate through to business attraction, business retention, and workforce attraction and retention. So the agricultural industry has been affected already by fracking in Pennsylvania, not just in terms of removal of productive farmland from the overall land base for agriculture, but also in terms of contamination. There have been plenty of examples of spills, soil contamination, water supply contamination in Pennsylvania, and those are just the ones that have been identified. So again, there could be this taint effect whereby agricultural production from these areas is seen as unsafe, and demand could go away. People might not be willing to buy produce from these areas. And I think as we see potential increases in overall numbers of wells that are active and overall disruption, there could be these bioaccumulative effects that again are difficult to trace, but if there's even uncertainty around the safety, the demand and the prices that farmers in these areas are going to be able to get for their produce is going to be very uncertain. And I know if I was a farmer, I wouldn't want to be anywhere near a well. So just in summary, when I think about this report, which was really a review of existing information and data, it tells us that communities in Pennsylvania are affected by fracking in all sorts of different ways and at almost every level, that homes, that households, that individuals, that businesses, that local agencies, that regional environments, ecosystems, natural resources. There are ways that fracking can negatively affect all sorts of resources and members of these communities. So I think each community has to look at what fracking means in their community and whereby fracking could have negative consequences, and whether those risks are worth the potential benefits that might be advertised. There are there are going to be differences from one place to another. There are going to be situations where wells are directly affecting water supplies, are close to people. But even in the areas where we don't know that there's a direct connection, there could be this long-term effect. So if I lived in this area of Pennsylvania and I was looking at this report, I would use it as a checklist or even a starting point to start to think about all of the ways we would want to evaluate any proposed new drilling or continued drilling in my community.
All right, that concludes the first video.
There's no such thing as a
And
writer.
I'm going to transition over to the next video now here. So just bear with me. Right, this one is 9 minutes. Goes more into the health impacts.
There are a few main takeaways, and one of our major takeaways was that the literature on this issue has grown substantially just within the past 2 years, and along with that, the ratio of studies that found a positive association between unconventional oil and gas development and a health impact, adverse health impact, has also increased. So we looked through in total 142 studies, and 127 of them, which is 89%, found in some way that unconventional oil and gas development is associated with a health impact. And then we found that 70 of those studies, or roughly half, were related to Pennsylvania. So whether that's through sample populations, including Pennsylvanians, or using monitoring within the state of Pennsylvania, or and any other way that the data was extracted from the state. And then 28 of our studies were focused specifically on Pennsylvania and the Marcellus Shale here. And of those 28 studies, 78% of them found evidence of a health risk. A second major takeaway from the report was that early life exposure, and including prenatal exposure, was the most studied topic. The research shows a link between unconventional oil and gas development and adverse birth outcomes and morbidity in children. Pennsylvania studies showed that unconventional oil and gas development is associated with low weight birth rate and preterm birth, and there is an epidemiologic link between drilling and early infant death. And another takeaway from the report was that health impact and exposure assessments focus primarily on air pollution. So local and regional air pollution, exposure to local and regional air pollution was the most widely acknowledged and also geographically widespread risk driver. There are several pollutants of concern. So, for example, volatile organic compounds, VOCs, and hazardous air pollutants, such as benzene, were repeatedly shown to cause adverse health impacts in the literature. These can be released at different stages of the drilling process, from venting and flaring to fugitive emissions and evaporation from flowback pits. Acute and chronic non-cancer risk and acute cancer risk was found to be associated with occupational inhalation of VOCs from flowback pits in the U.S. Another another pollutant of concern is particulate matter. Particulate matter is associated with silica-induced lung injury, respiratory illnesses, including asthma, and cardiovascular impacts, chronic neurological diseases in young children, and hospitalization rates of pneumonia. Also, exposure to silica sand from the very fine sand that's used as proppants to open the fissures of the shale gas rock also has associated health impacts. Retrospective health studies of workers who worked in industrial sand facilities showed high rates of silicosis from this work. And while these are retrospective health studies from before the onset of unconventional oil and gas development, they do indicate that exposure to silica from fracking is likely to be a contributor to silicosis in the future. In order to frack a well, it takes hundreds of trucks to carry in water and sand and equipment needed. Unconventional development involves these very large multi-well pads, and it takes millions of gallons of water and tons of sand and hundreds of different chemicals to hydraulically fracture a well. And all of that has to be brought in by truck, unless there is some, source of water on site. So all of these trucks and idling of the trucks and just traffic of the trucks is a huge contributor to air pollution. Impacts on mental health and well-being, including self-reported stress and worry about health, mental illnesses including depression, fatigue and sleep disturbances from noise and light pollution, general health symptoms, migraines and headaches, nasal and sinus symptoms. Hospitalization rates were shown to be increased for pneumonia among elderly populations, and also rates for hospitalizations regarding skin symptoms and diseases. Another source of health impacts is through groundwater contamination. The Pennsylvania Department of Environmental Protection officially acknowledges 335 cases of groundwater contamination associated with unconventional oil and gas development in the Marcellus Shale. We did notice a lack of studies that are looking at groundwater in relation to health impacts, which is likely due to the difficulties of tracking contaminants through groundwater transport. In Pennsylvania, an estimated 446,891 people live within a mile of a well, and 89,000 of them are under the age of 18. This is within a distance where the literature shows that there are adverse health impacts. And another important thing to note is that the way wells are spread out through this state, it's not uniform. Unconventional oil and gas development has the greatest impact in the northeast and southwestern portions of the state, with Washington County, Greene County, Bradford County, and Susquehanna County having the greatest number of unconventional wells. All of those 4 counties have over 2,000. In these 4 counties, in addition to Butler and Armstrong counties, the majority of the population, over 60%, live within 2 miles of a well. The results of this study clearly indicate that unconventional oil and gas development is impacting people's health. Furthermore, impacted communities clearly attribute declines in their health to unconventional oil and gas development. More high-quality epidemiologic studies are required to understand the exact causes of these health impacts, but that's not to suggest that the impacts aren't happening. They clearly are, and we're seeing it in the literature. So moving forward, we recommend that state agencies take a precautionary approach to unconventional oil and gas development and address these public health concerns before continuing to permit unconventional oil and gas wells. Our approach needs to acknowledge and accept as fact that residents' health is being impacted. And the current regulations that we have in place or the enforcement of these regulations isn't enough to protect our health. Permitting processes going forward need more public participation because the public obviously is being impacted. And this public participation needs to be meaningful. It can't just be, a box that's checked and then moved on. We need to listen to the concerns of residents because they are noting impacts in to their health.
All right. So, welcome back. Excuse me. Just a moment. All right. Tracy, are you still there?
Yes, I'm here.
Awesome. Thanks for sharing those 2 videos with us and for helping to bring these reports up. I'm seeing that there are quite a few questions coming in on the Q&A. So we're going to bring Mark in. And Erica is also on the line. Erica, are you there?
Yes. Can you hear me?
Awesome. Yes. Cool. Well, Tracy, do you want to say anything before we jump into the Q&A?
I just wanted to, for those who maybe joined after the initial introduction, say that Erica Jackson is a co-author of the report that was produced, the Categorical Review of Health Reports on Unconventional Oil and Gas Development Impacts in Pennsylvania, and that link to that report is available at on Halt Harm's webinar information there. And she authored the report with Samantha Malone and Kyle Farrar, and Erica has researched emissions and health impacts from unconventional oil and gas development, and also she's worked on environmental justice concerns having to do with Pittsburgh's air quality where she lives. And she does have a bachelor's degree in environmental studies at the University of Pittsburgh and has become quite familiar with the science and academic and health reports that have been issued in recent years. So it's really great that she's able to join us. I also want to say that Mark Buckley, who is the primary author of the economic cost of fracking in Pennsylvania, is with us on the line as well, and he's phoning in from the West Coast. And he leads the natural resource practice there at Eco Northwest in Portland, Oregon. He designs and he manages economic analyses that are typically involving water resources and land management. So he was able to really apply his expertise to the charge of looking at the comprehensive economic costs, including externalities of the development of shale gas and fracking. The majority of his work does focus on improving the efficiency of investments, and also that's for watersheds and water resources. So using his integrated planning and restoration and conservation perspective has helped to produce a great report too, and that report is also available by link through the Halt the Harm network.
Great, so we'll be able to send the links to those reports in the email right after this webinar, along with the replay. Great, so I think Mark, if you're on the line, let us know. Otherwise, I think he might be having some technical difficulties. I just sent him another link where he can click to join in. But we do have 5 questions in the queue right now. So I'll start at the top and with Marian. Can you still hear me, Tracy?
Yes, I'm here.
Okay, great. And Erica's there, great. So Marian says, what can be done when our Pennsylvania legislative reps keep on changing laws to favor the industry? It's ongoing and it's discouraging.
Well,
yeah.
So if you want me to take a crack at that, this is Tracy.
Yes.
You know, it is ongoing and it is discouraging. We do have to change the way our government is run in Pennsylvania, and that's a tall order. However, there have been changes that have been made that have changed the course of Pennsylvania history, and we believe that at this point in time, Pennsylvania really must stop additional new fracking, that permits should not be issued any longer, and we do not expect that the legislature, who seems to just be representing the industry's interests, those special interests, is going to do this. But we do believe that with enough public pressure from his constituents, Governor Wolf may do this. And we can talk a little bit further about it, but we do have a sample resolution related to achieving an executive order from Governor Wolf, which would stop the issuance of permits for fracking in Pennsylvania until these issues brought up by these two reports and other information is addressed.
Mm-hmm. Great. Thanks, Tracy. We have a question from Patricia. How long are these wells productive, and what happens to them when production drops?
So I can take that. So most wells in Pennsylvania have a lifespan of 5 to 10 years. In the counties with the highest production, the average lifespan is a little over 5 years. And so what happens after that is a really good question. So operators should plug the wells, filling them basically with concrete. However, a lot of times they let them remain idle, which means that they can go back later. They can cap them and then go back later to potentially frack them again, even though that oftentimes doesn't happen. And then the worst case scenario is when they're just orphaned and they're not properly abandoned. And that's a huge issue in Pennsylvania, not only from unconventional development, but also from conventional development, in which we have, thousands of wells throughout the state that are decades old, and we don't even have maps of them. And they could be leaking natural gas. So dealing with the legacy of unconventional and conventional gas is a huge problem. It's probably one of the biggest issues surrounding the state's gas production.
And I know there's an issue too of who's responsible for old wells as well, like if the responsibility or ownership changes hands and things like that.
Mm-hmm. So if a company declares bankruptcy, a lot of times it just falls on the taxpayer, and it's very expensive to properly abandon a well.
Yeah. Great. So Heidi has a question. Is there any work being done to analyze the harmful health effects in a quantitative risk analysis? We hear about the qualitative risks, but the quantitative risks are worth looking into to measure how much risk we are dealing with, etc.
Yes, definitely. There is research on that out there, and the amount of research is growing, and a lot of it actually focuses on Pennsylvania since we have so much activity here. So you can look at the data quantitatively, looking at disability adjusted life years. So how many years of your life, dealing with unconventional development, does that impact your quality of life? You can look at excess cancer lifetime risk, studies measuring exposure to certain carcinogens such as benzene or different VOCs. We'll look at that, excess lifetime cancer risk. There's a lot of different quantitative measurements, and all the studies are linked to in our article. There's a lot to go through, 142, but there are definitely a lot of quantitative numbers out there.
Great. I'm going to go to a question from Marion. We, on the whole, are knowledgeable with the results of many health reports. So what generally is reviewed is like preaching to the choir. What is being done collectively to convince lawmakers that they have created a problem and they need to address it?
There are efforts to bring this to the legislature and also to Governor Wolf. And tremendous amount of work has been done over the last couple months to bring the Compendium, which is produced by Physicians for Social Responsibility and the New York health professionals to the State House. There was a luncheon that was given for legislators presenting the findings of the Compendium, which looks at all of the reports that have been done about fracking, not just health, but all reports in prior years, and every so often they update it, and they just came out with the 6th edition. So just last month this was done. Erica Jackson was there, and so was one of the panelists discussing the results of the findings of these health reports and the preponderance of information, the weight of evidence that shows that fracking is ruining the health of communities where it's occurring. So there were legislators that attended, and then there was an evening seminar as well, with efforts to deliver this information to those who are in Harrisburg and voting. The problem is that we really need to use the democratic process to replace the special interest shills that are in place in Harrisburg. There's just way too much power in the hands of the industry through our legislators, and until we are able to get a foothold there as constituents, it's very difficult to change what's occurring. That's why we do and agree totally with you that it needs to be brought outside of the choir to legislators, but also to the general public, so people know what's going on. As much as we learn these things, regular folks, just most of them do not know about it. And the more that people learn, we believe that then that can be organized into an effort to accomplish a moratorium on gas drilling in Pennsylvania through advocating with our governor.
Thanks, Tracy. All right. Hey, Erica.
Sorry, I just saw your message.
Oh, that's cool. Yeah, so far we're, a couple of little technical snags, but we're transitioning to a brand new platform pretty seamlessly. So
Yeah.
I think just resent the invite to Mark, so expect he'll be able to pop in now. He's having a difficulty coming in on phone, but then also being a panelist. So, but he's been listening. We've got a couple more questions here, and hopefully Mark can chime in with some comments at the end. Jan is asking, or Jan says, this information mirrors the PSR, that's Physicians for Social Responsibility, 6th edition compendium on fracking. Are you collaborating since they have more than 1,300 studies now? Is there a reason that you chose to produce a different report than PSRs?
Go ahead, Erica.
We are collaborating, or we work with PSR. They have an event this Saturday in Erie, PA Health Checkup. So this study was a follow-up to one done by physicians, scientists, and engineers that looked at research from up until 2016. I'm not sure when the date it started. So this was kind of an update to that that Delaware Riverkeeper commissioned us to do. And it's focused specifically on Pennsylvania. So basically we wanted to update, see what is new. We found that the research had grown substantially from that previous report. And we found that the ratio of study evidence and impact had also increased.
Yeah, I would just add that we wanted to focus as much as we could on Pennsylvania and look at both the health and the economic impact. So we had these two reports, and we definitely do work with Sandra Steingraber and Karen Ferridan with the Better Path Coalition, with the Tammy Murphy at PSR and the other folks that are working on these issues. But we wanted to look at a category from a different point of view a little bit. We wanted to categorize what these impacts are in Pennsylvania. So it's a more specific, sort of focused look at the health impacts through the lens of a Pennsylvania resident, worker, person, as opposed to the whole U.S.
Mm-hmm. Want to welcome Mark, who just joined us by phone. Hey, Mark.
Hi, can you hear me now?
Yeah.
Okay, great. Yeah, I've been on during the calls, but I thought I had to wait to get unmuted. Sorry about that, folks. I guess I had to do something on my end.
Yeah, it's fine. It's great to have you here. We still have some more questions left. We still have some time left. So any comments that you want to jump in on? And I'll read the next question from Julie, who says, my understanding is that Pennsylvania state law requires only a 500-foot setback from the well pad. Much larger setback distances are needed. How do we convince our state legislators that such a change is needed, especially in the face of oil and gas lobbyists who seem to have a pervasive influence over our legislators?
I hate to keep answering the questions because this is, but this is sort of a question about government, and I just wanted to say that that's the minimum in the state regulations. However, municipalities can adopt ordinances that increase the setbacks, and that's part of what we are hoping will occur as a result of more information and scientific reports that shore up the community that wants to increase their setbacks. So once you get the report, and for instance, if you look in the Frac Tracker Alliance report that looks at the health reports, you'll see that there's a lot of information there that's categorized for that a community could use in order to adopt an ordinance that has greater setbacks. We know that people suffer greater health effects as a result of fracking if you live within anywhere between 2 miles, 1 mile, and a half mile. So the closer you get, the greater the impact. And this is information that communities need and are using right now in defending their own efforts to try to get stronger protections at the most local level.
Mm-hmm. And Patricia just jumped in and said, but don't state regulations override local ordinances?
Not on zoning, no. They override it on how fracking is done. You can't say, for instance, you can't use chemicals, or you have to do certain practices when you're extracting gas. But in terms of location and zoning and setbacks, municipalities can adopt ordinances as part of their municipal planning process.
I'll mention too that last webinar we did was with Fair Shake Environmental Legal Services, and it was all about zoning. And so the replay for that is available. But then also the Ryan Hamilton, who's working with Fair Shake, is and just the Fair Shake in general, they would like me to tell everybody that you can contact them with questions that you might have, as well as the zoning resources that Mountain Watershed Association has worked really hard to put together on the Fracking Help Center. There was a question that came in via email from Luann, who asked, are people who are on properties that are impacted by fracking able to sell their homes? And if so, to who? And would they have to sell for lesser prices? How does the
Mark,
fracking impact home? Yeah, thanks, Mark.
Yeah, what we have seen is that they have to sell at lower prices. There are people who tend to be willing to pay something above zero. We see this in more extreme situations in urban areas often, and this is probably one of the important drivers for some of the most pervasive environmental justice issues, where the only buyers are the ones that are only able to afford a particularly low price. So you end up with people living near those that are generally lower income. So you end up with more extreme concentration of lower income and less ability to adapt and manage health costs in those areas.
Mm-hmm. Great. So we're right on time to wrap up the webinar. We have one more question from Heidi, and I want to see if either you, Erica, or Mark have anything else that you want to add. Heidi asks, we passed SB 181 in Colorado, where we get more local control over oil and gas, and waste is redefined under law so the oil and gas industry can stay in the ground legally to protect health, safety, welfare, and environment. Here's the bill you could suggest in Pennsylvania. So I guess it's not as much of a, okay, so Heidi jumped in and said, would this bill help? And provided a link to the bill. Yeah, so what do you all think about that?
Thank you. Yeah, thanks for sharing that. There's definitely a lot of different methods to deal with difficult legislators, and redefining waste. Maybe that's the path that it could be something people in Pennsylvania are already working on. I'm not aware of, but I'll definitely look into it. So thanks for sharing.
Awesome. Yeah, there's so much that we can exchange with each other from different states that have different ways of approaching the industry.
Mm-hmm.
So Erica and Mark, would you like to say anything else about your work on the report?
Well, this is Mark. I'm happy to chime in a little because I know I haven't had a chance to speak as much. Apologies for double booking, but I think the key takeaway that I would reiterate and emphasize in the context of some of these questions is that the effects of fracking are a particularly uncertain area of environmental policy and pollution problems in general. And that means that sort of precautionary principle types of approaches are most important. And especially when you have ambiguous sort of competing arguments, it can be very difficult for the general public to understand this. So having clear, simple messages around what those effects are and in a way that they can understand, I think is important. And what we try to do on the economic side of things, we know that we're not the whole story by any means, but we're trying to translate the science as well as we can into things that people care about. And sometimes that doesn't need to be a dollar value. So I think talking about the kinds of effects, the health effects, the quality of life, the regional economic development, attraction of an area, all of those things can be just as powerful as just throwing out a big dollar value. And I would encourage that sort of working through the list and then looking for any particular context for the proofs, the demonstrations that those negative consequences either are occurring or are very likely given the conditions, the environmental conditions, the socioeconomic conditions where people are living, and not try to focus just on the dollar values too much. Thanks.
Mm-hmm. Mm-hmm. Great. So as we start to wrap up, I want to point out to everybody that you can watch and share the replay over at halttheharm.net/webinars. You can also check out the frackingnextdoor.com, which is a place that you can refer people to. Essentially what this website is it refers people to the Fracking Help Center, which is a support desk, online support desk for questions that you might have about impacts of oil and gas, legal process and protections, advocacy and resources. You might start seeing this little icon that you can see in the bottom right of this slide on different websites like halttheharm.net, on fractracker.org. Protect PT now has one. Southwest Pennsylvania Environmental Health Project has it. This little icon actually opens up and is a place to ask questions and draw from this knowledge base that we're building as a community. So everybody who's listening and paying attention on the webinar can give feedback and help to improve this base of knowledge that we're all sharing with each other. That's called the Fracking Help Center. And I just want to take a moment and thank everybody so much for coming on the webinar today. And I'm going to send you a brief survey. And you can also contact me with any suggestions or questions for future trainings. And I'll follow up with you with all these links, as well as the links to the reports that Tracy and Erica and Mark were sharing data from today. So yeah, thank you so much, everybody, for being here and for participating in the webinar.
Thank you, Ryan.
Yeah.
Thanks, Erica. Thanks, Mark.
Great. Thanks, everyone.
Yeah. And we'll see you at the next webinar. We have one every week or so for the next few months. And, so we'll be connecting. Talk soon.
Bye.
Awesome.
Bye, Erica.
Yeah.
Bye, Tracy. Bye, Mark. Bye, everybody.